to one of the area clinics, and they got to actually do like hands-on, you know, radiology. I can't remember what you call with drawing blood, the lab area. They got to actually go into them areas and do like some hands-on, so they actually got to learn how to use a stethoscope, learn how to do blood pressures, and it was to make sure that they knew that whatever field that they were looking at, they had a hands-on, you know, example of what they're going to be doing. And so that might be something at some time IHS might want to look into doing. The other thing that I had was the maternal health, women's health. You know, that's really a big thing here. We have a high rate of cancer. I don't know when the lady leaves, but I know that she's on 2-week break, 2-week on, 2-week break in that department. And I do know that she's expecting, and so I don't know if you guys have plans for someone to be 5 days a week while she's gone, or how that's going to work. But I'd like some information on that. The other one is our mental health department. Where are we at with maybe getting a hold of area office to possibly get us more mental health workers down here? It's not just our children that are hurting. We also have our adults that are hurting. You know, so it'd be really good because of this COVID and stuff going on that we get some mental health workers here. The other one is the board of directors. The last time I was on council, the health board used to go up there and meet with you guys at that time, and I don't know when it changed, but now it's just the health board chair or the vice that attends if the chair can't attend. But I really think that it should go back to being the health board that is allowed to attend those meetings, if you can work on that. Thank you.
Okay. So, thank you.
Lisa had another question too, but if you want to respond back, go ahead.
Yeah,
okay. For the CNM, yes, we're in the final recruiting stage for another certified nurse midwife. That's what the CNM is. And to backfill, we also have a contract CNM that's going through the initial phase right now. So we should be fully covered. With the behavioral health staff, we are fully staffed right now. We do not have any vacancies in behavioral health, and absolutely I'll make sure that the invitation goes out to the health board when we have our governing body meetings. At the last meeting just last week, I believe it was, I know that Skyla attended.
Lisa, go ahead.
Good morning, thank you for coming. So I know I've listened in on a couple of the mental health meetings that you have with the court, and maybe you could kind of give council some information on how those meetings are going, and if you need any of our support on anything.
Yes, absolutely. So the adult corrections and Indian Health Service have been meeting in Judge Marshall's chambers on a monthly basis. Generally, it's the first Monday or first Friday of every month. And part of the discussions we've had so far have been just about safely managing mental health patients between Indian Health Service and the corrections facility. Some of the checklists of the to-do items that Indian Health Service had to do, one of them was the ligature-free room, which we have completed. And also they wanted me to check into to see if there's any other options for telehealth. within the prison facility. So the Judge Marshall moved the meeting from the first Friday. It's actually tomorrow, so I'll be meeting with them again tomorrow with their updates. And I think it'll be received very well that we are going to be recruiting for a psychiatric nurse practitioner to assist with medication management issues.
Or the behavioral transports, any issues with that?
So So the behavioral health transports, those are actually managed by the by EMS. You know, at this point, we did a full-scale assessment to see if it would be feasible for Indian Health Service to do those transports. And initially, we thought, oh, well, this sounds pretty easy. We can get a GSA vehicle. We can get some of our on-call staff just to transport mental health patients between here and wherever they had to go to, you know, using a GSA vehicle. At a glance, that sounded really good, but it's actually very high risk. You know, it's a high risk to our staff, and it's a high risk absolutely to the patient. If they have a medical issue en route, or a behavioral health issue en route.
It'll be like lack of security.
Security and you know, the support that they need. They may need mental health support that absolutely a driver, you know, either somebody from housekeeping or just a driver, a full-time driver, would not be able to accommodate them. We also looked at maybe putting up a barrier between the driver and the passengers, and that's not safe either. So it just, the best way to transfer a behavioral health patient is going to be via ambulance.
Any more questions? Russell?
I just have a couple of questions. And it's lunch break now, so I'm assimilated when it comes to food. I like to eat in white man's world, you know. But the first question is, I'm kind of curious. When you had a contract with the veterans to come and be able to be serviced by Rosebud, well, since that time, the VA kind of pulled back from Indian Health Service, and I'm kind of questioning why. Do you know why?
So with the veterans IHS MOU, I believe that's what you're referring to, yes. And in fact, we just had a phone call yesterday with Dan Davis. We're looking to see where the updated copy of the VA IHS MOU is and see where that stands. I know that it was in final format, and under the Veterans IHS MOU, of course, what that means is a Native veteran comes to an IHS facility, and if they do not have any other insurance, we can bill the VA for that visit. That's basically what that means. And we also will help do with the case management if they need to go get further services and try to get them into the VA for care that we cannot provide. But I should have more information. I know that we're going to be meeting at some time next week, but I'll make sure I can let you know where it stands.
I believe there's a upcoming meeting with VA and some of their leadership, and I think they're going to be requesting your presence and also the Aberdeen area director, because it is a vital service to provide to our veterans. So I'm hoping that you're aware of it and on top of it. And my second question is, what's the status of ambulance service submitting requests to you for additional funding. You know, that's always been an issue. I'd like to know what kind of, I know, you know, funding's always an issue. But at some point here in the last few months, ambulance service director said they've been submitting requests. However, they get denied or they don't get an answer back. But other reservations are getting additional funding. So I kind of want to know why, you know, why we're being left out. And I think, to me, it's, you know, we had an ongoing lawsuit at that time, which now it's resolved, but, you know, and so, maybe, you can find out, let me know at least where that's at.
Thank you. So the first question, you know, with the veteran IHS MOU, you know, I'm a veteran, so I too am very, I have a personal investment in making sure that we're taking care of our veterans that come through Indian Health Service. I am for all patients, but of course, as a veteran, I kind of have a soft spot there. But yes, as soon as, you're right, they are going to be setting up a meeting, and as soon as I hear about that, I will let you know about the IHS VA MOU.
Yeah, go ahead, Lisa.
At our health admin meeting on the 3rd, our council rep Marshall, to sit on the Veterans Affairs, he made a motion to have President Herman write a letter to IHS inviting them to a telemeeting on the 10th, which is today at 1:30, regarding the mobile unit to go out to the communities for the veterans. So, I don't know, I did let Scott know, I don't know if that letter went out or if he contacted you, but I don't have any information on who's setting up that telemeeting. I think Rod Bordeaux, he sits on Veterans Affairs, so he might be setting it up.
I think it's at 1:30.
Yeah, it's at 1:30. I have it on my notes. On the 10th at 1:30, so. But I don't know,
I
do
haven't
you have a
got,
contact for Rod, or?
no, I don't have a contact for him, but I can get his phone number.
Okay, or maybe, get a hold of Councilman Marshall and see if he has any information on that.
Okay.
But that's in about an hour. He was, one of the applicants yesterday.
Yeah, he was, yeah. So I should be able to get his phone number. Anything else?
Can I get special treatment when I come up there? Because I'm on a tribal council? I'm just teasing.
I've instructed staff to roll out the red carpet to everyone.
Pam, you got another comment?
On your report for, I believe it was last week up until today, the numbers that you gave under the state PCR positivity rate, you have highlighted 2%, and that's for, that was for the 8th, 9th, and 10th. What does that mean? I mean, does that mean that we've dropped down to just 2% positive rate here? Or what does that mean?
It means, if you look at the report, I think it goes back about 30 days, and you can see that within the past 30 days, and I don't want to misquote, but I was looking where it was 25, our rate was 25, and now we're down to 2%, and that's what I mean, that it has lowered. Our positivity rate has lowered to 2%.
For just our area, not...
Correct.
Not the entire place, area?
Just out of IHS.
Just, yes, for the Rosebud area, yes.
Okay, and then, I forgot what my other question was. Sorry.
Dara, do you have a question, comment?
Yeah, Pam had mentioned something earlier about like trainings and stuff like that, you know, for like phlebotomy and, you know, the different little programs, departments, I guess, like for drawing blood would be the phlebotomy, which only takes like 9 months to get certified, you know. I think Red Cross, when they do their blood drives, I think they certify their phlebotomists. I'm working off my cousin's credentials in Phoenix. She only had to take like a 4-week course, you know. If it was possible, that tech row, you know, that's our employment contracting rights office. If we could build some kind of program up, because we want to bring in welding programs, you know, we want to do these things that can help us, CNAs, phlebotomy, you know, the medical field's really important, and IHS has the scholarships available to fund our Lakotas, and then it requires, I think, 1 year of working at IHS facility, and then, you know, you're kind of repaid. So is there ways that, you know, obviously we can't live off you guys, and we can't really depend on you for every dollar, but if we were to match something, like to bring in money to find, you know, the possible means to train and school 5 Lakotas for phlebotomy that would go back into your program, you know, and be taught by your skilled laboratory technicians. You know, there's avenues of employment opportunities that we need to work on, and is it possible that you guys could collaborate and help us with that fact? Thank you.
Thank you. And so that's a really good question, and that is one of the reasons we're having the career fair. We will have all of our resources. They'll be coming in from the Great Plains area, talking to us about opportunities and talking to the students, more importantly, the students, about options for them. And there's a lot of opportunities out there for Native students to get their education paid for, to get into the healthcare field. And that's what our contacts will be. They'll be sharing some of that information. So they'll have a lot of literature available about how that can happen.
Okay, and then also on your billing and stuff, your third-party billing with the Medicaid and Medicare, I know of some Oyate that said they were having problems like with referrals. A lot of them, it wasn't getting paid. There was miscommunication between IHS and Medicaid. So can you kind of tell the Oyate a little bit more about that? You know, let them know just where they stand, because sometimes some of your employees aren't very nice when we call down there, and some of our elders have English impediments. You know, they're Lakota speakers first, so sometimes their vocabulary is laughed off by the government employees as you're dumb and, you know, what are you talking about? So, you know, we can't get our answers. We can ask our questions, but we're not answered or we're laughed off. So can you kind of elaborate on the third-party billing? Because that's a main issue, and it seems to be catching us where we can't get services for our ailments. You know, we can't get it done unless we have that other sort of insurance, and we always get tied back to you guys, so.
Absolutely. You know, for purchase referred care, and yes, there is a long-standing history, I believe, with Rosebud, and the Rosebud purchase referred care, we're only approving the priority level ones, and the priority level ones is basically loss of life or limb. You know, the suicidal patients, of course, are priority ones. Individuals that had to be transferred out of here were priority ones, either via ambulance or air ambulance. But we are now, and we have been for some time, approving the priority level 2s through the 4s on an individual basis. But there is always going to be an instance where even for those people that we have referred out, and it'll have to happen to the elders, that they would be billed for it. And while our payment is still tied up in our financial system, the best thing for that individual to do, I would gladly take a look at the bill and find out what's going on with it and make sure that we get that individual taken care of.
Okay, that's good. And also, like, on the referral process, I have an Oyata, a gentleman who has a bad back, and it's delaying his work process. And it literally took 3 years from IHS to send him to Winter, South Dakota to get an x-ray. So it's like, you know, an MRI. Why does it take 3 years for our people to even get their back evaluated? Why would it take so long of a referral?
And that is such a good question, and as I mentioned, that's what the difference is between the priority level ones, because it's only been in the past 10 months that we have been approving 32s, the 3s, and the 4s. The 2s would cover a thing like an MRI. We've only started approving those in the past 10 months, and it's about management.
Yeah.
You know, we needed to do a regroup on the way that we were doing PRCs and follow the policy. If we follow the policy, we're going to be okay. So I certainly do apologize that there was such a delay. But anytime that type of thing occurs, we look at each and every referral, and if we could pay for it, we will. We will. You know, PRC is always going to be the payer of last resort, and we do everything that we can do to accommodate that patient.
That's good. Thank you for telling us that. Also for the hospice care, we have a lot of our elders who are leaving this world, and I had a family ask me why that their Unchichila couldn't come home and leave this world at our own hospital. And they were quite, they didn't like it, and I couldn't tell them an answer. I had tried calling the IHS. It's a very automated service, and you guys are like a telemarketing service. It's hard to get through to anybody there. It was to no avail, and they ended up having to go out of state, and that's where their elder passed away. So why are we doing something to accommodate that hospice area? My own mother passed away at the Rosebud IHS complex, and I'm very grateful to the nurses and staff, but we need to provide that service for our people as well. So what was the delay there, and why are we denying elders the chance to come home and leave?
So there's two answers. And one is anytime that we are notified that there's an individual, we call it palliative care because we are not a hospice facility, but we call it palliative care, and we do it because it's the right thing to do. Sometimes, you know, it's going to mean that Indian Health Service doesn't necessarily get reimbursed to provide that care, but we do it because it's the right thing to do. And there hasn't been a single time that we've said no, not to bring an elder home that needs that palliative care. You know, it just happens that, you know, they're not able to go home or even have hospice in their own home for whatever reason. And we know that our environment, they will be as comfortable as can be. And we try to offer that service. I apologize for the telephone system. But if that issue arises, please call me.
Okay, thank you very much. Thank you.
That's all I have.
Is that all?
Yep.
Okay, all right. Thank you, Dara.
Yeah.
Is there any more formality? Russell says he's assimilated, so. Okay, Melody, that's a great report. Thank you.
Thank you. Thank you for having me.
Yep.
Did you say your meeting was?
We probably can.
So the governing body, we met last week, so we don't have a date for our next meeting yet.
Your one that you have weekly.
No. So we meet quarterly for the governing body, and that's with area, with the Great Plains area.
No, it's just with this, I just like with you and your chief doctor, that, right? Just discuss what's going on within the facility.
We have some internal meetings. Yes, we do. I mean, we have huddles. It's not a meeting.
I don't remember what those meetings were called, this is not here as a
Well, she's talking about the quarterly meetings, but we have one, when I'm able to come up and be a part of those meetings, that's what she's talking about.
Okay, yes. And we send those invitations. The next one was scheduled to be April 28th, but because that's the day of our career fair, it's going to be moved out. It'll be right in that time frame. They haven't picked a date yet. But I usually send a written invitation.
Yeah.
It goes to the president, and it also goes to Skyla.
Okay, do we need a motion to approve IHS's report? To Neil, seconded by Cher, question by Martha. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Online, Eileen?
12. Eileen?
Stanley? Donna?
Yes.
14.
Opposed?
0.
Not voting.
1.
Motion carried. Thank you, Melody.
Thank you for having me.
Go through and give, or did you already do that?
Thank you. I can reach. Thank you. Thank you. I won't touch your hands. Oh, he wants to be the wolf.
I need to start cool on that. Oh, God. You got it. Come on. Will you stay out?
Thank you. Good work. Come on.
Bakugashila, Emana, Wichuka, yeah, Wait, yeah, don't go to Gashila. Pictures them, which was an Imashia, when each of the road from Gashila. Namusha, oh, Mita Clearance.
Our lunch break till 1:30.
1:30, council.
Pay attention to these two PSAs. Thank you from the Rosebud Sioux Tribal Hemp Commission. Ampetu ashte yuhapo. Aho.
everybody. This is Stephen Denora III, Tribal Treasurer for the Rosebud Sioux Tribe. I would just like to take this time to encourage everybody to get your vaccine, get your booster, and wear a mask. Thank you and stay safe.
Chichango Oyate, Ampetu Washte. Lehe Waha Chunka Mato, Lakota Imachiapi. English, Wayne Bearshield. But all my people know me as Shoe Bear. Hey, I'm speaking on behalf of the Hemp Commission this morning, today. The Hemp Commission is accepting growers license applications. You have to go to rosebudhemp.org to get the application, rosebudhemp.org. It has a listing of all the commissioners, the applications, the fees, the steps that you have to go through. The second part of this PSA is to inform all you retailers out there that are selling hemp products. The Rosebud Sioux Tribe does have a retailer's license for hemp products. Please go to rosebudhemp.org, rosebudhemp.org, to get this information. It was installed last year and came into effect this year. So if you are selling hemp products of any kind, please go to rosebudhemp.org and get your retailer's application filled out, sent in with the applicable fees and everything, and we can get you approved and you can have a license from the Rosebud Sioux Tribe Hemp Commission hanging on your wall, making sure you are legal. Once again, pay attention to these two PSAs. Thank you from the Rosebud Sioux Tribal Hemp Commission. Ampetu Ashte Yuhapo. Aho.
this is Stephen Denora III, Tribal Treasurer for the Rosebud Sioux Tribe. I would just like to take this time to encourage everybody to get your vaccine, get your booster, and wear a mask. Thank you and stay safe.
Chichango yate, ampetu washte. Lehe waha chunka mato lakota imachiapi. English, Wayne Bearshield. But all my people know me as Shoe Bear. Hey, I'm speaking on behalf of the Hemp Commission this morning, today. The Hemp Commission is accepting growers license applications. You have to go to rosebudhemp.org to get the application, rosebudhemp.org. It has a listing of all the commissioners, the applications, the fees, the steps that you have to go through. The second part of this PSA is to inform all you retailers out there that are selling hemp products. The Rosebud Sioux Tribe does have a retailer's license for hemp products. Please go to rosebudhemp.org, rosebudhemp.org, to get this information. It was installed last year and came into effect this year. So if you are selling hemp products of any kind, please go to rosebudhemp.org and get your retailer's application filled out, sent in with the applicable fees and everything, and we can get you approved and you can have a license from the Rosebud Sioux Tribe Hemp Commission hanging on your wall, making sure you are legal. Once again, pay attention to these two PSAs. Thank you from the Rosebud Sioux Tribal Hemp Commission. Ampetu washte yuhapo. Aho.
this is Stephen Denora III, Tribal Treasurer for the Rosebud Sioux Tribe. I would just like to take this time to encourage everybody to get your vaccine, get your booster, and wear a mask. Thank you and stay safe.
Chichango yate, ampetu washte. Lehe waha chunka matola kota imachiapi. English, Wayne Bearshield. But all my people know me as Shoe Bear. Hey, I'm speaking on behalf of the Hemp Commission this morning, today. The Hemp Commission is accepting growers license applications. You have to go to rosebudhemp.org to get the application, rosebudhemp.org. It has a listing of all the commissioners, the applications, the fees, the steps that you have to go through. The second part of this PSA is to inform all you retailers out there that are selling hemp products. The Rosebud Sioux Tribe does have a retailer's license for hemp products. Please go to rosebudhemp.org, rosebudhemp.org, to get this information. It was installed last year and came into effect this year. So if you are selling hemp products of any kind, please go to rosebudhemp.org and get your retailer's application filled out, sent in with the applicable fees and everything, and we can get you approved and you can have a license from the Rosebud Sioux Tribe Hemp Commission hanging on your wall, making sure you are legal. Once again, pay attention to these two PSAs. Thank you from the Rosebud Sioux Tribal Hemp Commission. Ampetu ashte yuhapo. Aho.
this is Stephen Denora III, Tribal Treasurer for the Rosebud Sioux Tribe. I would just like to take this time to encourage everybody to get your vaccine, get your booster, and wear a mask. Thank you and stay safe.
Chichango yate, ampetu waste. Lehe waha chunka mato Lakota imachiapi. English, Wayne Bearshield. All my people know me as Shoe Bear. Hey, I'm speaking on behalf of the Hemp Commission this morning, today. The Hemp Commission is accepting growers license applications. You have to go to rosebudhemp.org to get the application, rosebudhemp.org. It has a listing of all the commissioners, the applications, the fees, the steps that you have to go through. The second part of this PSA is to inform all you retailers out there that are selling hemp products. The Rosebud Sioux Tribe does have a retailer's license for hemp products. Please go to rosebudhemp.org, rosebudhemp.org, to get this information. It was installed last year and came into effect this year. So if you are selling hemp products of any kind, please go to rosebudhemp.org and get your retailer's application filled out, sent in with the applicable fees and everything, and we can get you approved and you can have a license from the Rosebud Sioux Tribe Hemp Commission hanging on your wall, making sure you are legal. Once again, pay attention to these two PSAs. Thank you from the Rosebud Sioux Tribal Hemp Commission. Ampetu ashte yuhapo. Aho.
everybody. This is Stephen Denora III, Tribal Treasurer for the Rosebud Sioux Tribe. I would just like to take this time to encourage everybody to get your vaccine, get your booster, and wear a mask. Thank you and stay safe.
Chichango yate ampetu washte. Lehe waha chunka mato lakota imachiapi. English, Wayne Bearshield. But all my people know me as Shoe Bear. Hey, I'm speaking on behalf of the Hemp Commission this morning, today. The Hemp Commission is accepting licensed growers license applications. You have to go to rosebudhemp.org to get the application, rosebudhemp.org. It has a listing of all the commissioners, the applications, the fees, the steps that you have to go through. The second part of this PSA is to inform all you retailers out there that are selling hemp products. The Rosebud Sioux Tribe does have a retailer's license for hemp products. Please go to rosebudhemp.org, rosebudhemp.org, to get this information. It was installed last year and came into effect this year. So if you are selling hemp products of any kind, please go to rosebudhemp.org and get your retailer's application filled out, sent in with the applicable fees and everything, and we can get you approved and you can have a license from the Rosebud Sioux Tribe Hemp Commission hanging on your wall, making sure you are legal. Once again, pay attention to these two PSAs. Thank you from the Rosebud Sioux Tribal Hemp Commission. Ampetu ashte yuhapo. Aho.
this is Stephen Denora III, Tribal Treasurer for the Rosebud Sioux Tribe. I would just like to take this time to encourage everybody to get your vaccine, get your booster, and wear a mask. Thank you and stay safe.
Chichango yate ampetu waste. Lehe waha chunka mato lakota imachiapi. English, Wayne Bearshield. But all my people know me as Shoe Bear. Hey, I'm speaking on behalf of the Hemp Commission this morning, today. The Hemp Commission is accepting growers license applications. You have to go to rosebudhemp.org to get the application, rosebudhemp.org. It has a listing of all the commissioners, the applications, the fees, the steps that you have to go through. The second part of this PSA is to inform all you retailers out there that are selling hemp products. The Rosebud Sioux Tribe does have a retailer's license for hemp products. Please go to rosebudhemp.org, rosebudhemp.org, to get this information. It was installed last year and came into effect this year. So if you are selling hemp products of any kind, please go to rosebudhemp.org and get your retailer's application filled out, sent in with the applicable fees and everything, and we can get you approved and you can have a license from the Rosebud Sioux Tribe Hemp Commission hanging on your wall, making sure you are legal. Once again, pay attention to these two PSAs. Thank you from the Rosebud Sioux Tribal Hemp Commission. Ampetu ashte yuhapo. Aho.
Coverage of the South Dakota High School Activities Association event is made possible by a partnership between the SDHSAA and South Dakota Public Broadcasting. Sponsors of SDPB's coverage include Dakota Bank, South Dakota Corn, and by the Independent Insurance Agents of South Dakota, Bank West, SDSU, the South Dakota Department of Education, and by your membership in the Friends of South Dakota Public Broadcasting.
By Aberdeen Roncalli, Viborg Hurley going to go into their press breaker. Who's going to break deep? It'll be, oh, what a save! And then a foul. Coral Mason thought she got pushed out and just got to fling it, and it goes right into the hands of Estelle Lee, who takes off up the court and gets fouled.
And back to the free throw line. We'll go for Viborg Hurley. Probably has to be the player of the game for the Cougars today, Brad. The job this young lady has turned in.
I mean, take your pick, actually, between Lee, Mason, and Mock, those three. on their way to the state semifinals. 11.6